Hello, this is the detection method for detecting carrier of Mendel's disorder presented by the essay SchrDbb reference ABC of Clinical Genetics by Helen Kingston. So, here we are going to visualize how to detect carriers. So here you need to know that what you have a risk of offspring to be carrier. If you have a recessive mutation, there is no risk for them to be carrier unless the partner is carrier. If there is a dominant mutation, 50% risk for them to be carrier, and if it's an X-linked mutation, it's 50% risk to be carrier, and all to this to carrier risk to male offspring. Is it clear? Now, there is what is called obligate carriers. So you say that what you need to know that I've already spoken about X-linked disorders, and then there are certain people in X-linked disorder that must be in certain disorders that must be obligate carrier. There is no need to do a genetic karyotyping in order to understand again their pattern. They must be carrier, both of them, basically, except there is a de novo mutation, because there are certain cases that may occur. We have different inheritance methods. It can be Mendelian inheritance method by single gene inheritance, chromosomal abnormality. It can be a new mutation. It can be somatic mutation, a somatic mosaicism. Is it clear? So those are the different methods of inheritance of a patient. Now, in obligate carriers, so what are obligate carriers? So obligate carriers occurs when first you have, in cases of autosomal dominant disorder, if the father of this child is of this male child is having the disease, and the child of this person is having the disease, it means that this male here must be an obligate carrier. Is it clear? So if the father is having an autosomal dominant disease and the child of that person is having an autosomal dominant disease, it means that this person is having the allele of autosomal dominant disease. Now the question you may ask me is, why is it that this person is not going to be affected by this disease though he is having an autosomal dominant allele? The answer is simple. It's because of variation and penetrance. Variation, as I've already explained in the previous tutorial that I recommend you to go and see back, is that variation is the degree of the expression of a particular pathogenic allele. The degree of expression of a pathogenic allele means variation. It means that certain people have a very severe form of expressing the disease, like these two, while certain others have a very mild form of expressing the disease that may not even be seen. But in case of penetrance is the ability for you not to express any disease while you have a pathogenic allele in yourself. Is it clear? And a pathogenic dominant allele in yourself. So the ability for you to express the disease, not to express the disease, but the ability for one person not to express the disease while he has a pathogenic autosomal dominant allele in himself. So you see this. Now, autosomal recessive disorder, if one child in a couple, only one child, not even two as they have shown here, if only one child in a couple is having autosomal recessive disease, it means that both parents must be obligate carrier. Is it clear? Not even two children. If only one child is having autosomal disease, it means that both parents must be autosomal carriers. So autosomal recessive gene carriers. Now in this case again, if this one mother is already autosomal recessive carrier, it means it's already affected. So since if one child autosomal recessive disorder is affected, it means that all the children must be obligate carriers. Is it clear? Now in this other case scenario here is an X-linked recessive condition. So in X-linked recessive condition, you see that what if one child in the family is already a carrier with an X-linked recessive condition. Is it clear? If one, not any child, but if one male in the family is having the disease, not a carrier, is having the disease with an X-linked recessive disorder, it means that the mother must be obligate carrier, because the child is only going to receive the Y chromosome from the father, and the child must receive the X chromosome from the mother. Is it clear? So if that child is having a pathologic X chromosome, it must come from the mother. Is it clear? So the mother must be a carrier. Is it clear? So that is the first point to put in mind. But what you have to know also is that if the male is affected, the female may not be the carrier of that gene, because the mother may transmit the good gene to the other female. Is it clear? This female carrier state is not coming from her brother. Are you understanding? But this female carrier state is coming from her child. Are you getting me very well? So this female carrier state is not coming from her brother, but it's coming from her child. That's why we're still talking about conditional probabilities that are used when you can derive that you have seen above the that I said I am not going to explain the calculations of conditional probability here, because it is very actually long. We are going to use very long formulas. So in conditional probability, you use the probability of the previous generation, like year and year, and use the probability of the next generation in order to prove the probability of the person in the middle. Is it clear? So that is a conditional probability. So if the children are this, then the mother is this. If the brother is this, then the mother is this. That's a conditional probability. Now, the conditional probability, the probability for the mother to be carrier is coming from her child. Since a child is already affected, it means that the mother must be a carrier. And now, a male child, if a male child is affected, all the females in X-linked recessive disorder must be carriers. That's how the patterns of transmission is going with those disorders. Now, autosomal disorder. So, what are some examples of autosomal dominant disorder which are amenable to carrier detection? So, how can we detect based on carrier detection? We have adult polycystic kidney disease that can be detected with for carrier detection. Charcot-Marie-Tooth disease, facioscapulohumeral dystrophy. All these disorders can be amenable to carrier detection. You can detect the carrier. So, provided that you don't use, or we can use obligate carrier status, where you don't use any method of, you don't use any gene diagnosis, genetic diagnosis, in order to see the carrier status of the parent, the brother, and any relationship. Now, there are apart from obligate carrier method, there are certain methods that can be used, and these are certain diseases where you can use those methods in order to visualize the carrier status. Is it clear? So we said von Hippel-Lindau disease. So you can, all of them, you can visualize. You can use certain genetic techniques. Like we said, there was molecular genetics, there was biochemical genetics, and there was cytogenetics that both all can be used in deriving this carrier status. Now, what are some autosomal recessive disorders which are amenable to carrier detection? So we have population-based screening, like in the case of thalassemia. In thalassemia, you can detect the carrier status. Cystic fibrosis can detect the carrier status. Sickle cell disease or that Tay-Sachs disease can detect the carrier status. There are different methods. This is with biochemical analysis. You can analyze the molecules, like in thalassemia, you can analyze hemoglobin. Cystic fibrosis, you can analyze certain receptors, enzymes that are going to be present inside the blood. All this is with biochemical analysis, and also have family-based testing that you have also. You can also detect the carrier status. Now, these are X-linked recessive disorder that you can also detect the carrier status. You have adrenoleukodystrophy, albinism, ocular albinism. We are talking about ocular albinism. You can detect the carrier status also in this patient. Alport syndrome, you can detect the carrier status. All these diseases, you are capable of extending this research. You are capable of detecting the carrier status based on chemical analysis or molecular analysis or any analysis of your choice. Is it clear? Now, this table is also telling you that what there are certain patients who do not only inherit their disorder from a Mendelian pattern. Is it clear? There are certain different forms of also inheritance. New patients, there can be also new mutations. Certain people can inherit their disorder, their new mutation. Means that what you never had an autosomal dominant disorder in the family, but it's only from this person that achondroplasia, as an example, or Hutchinson disease developed. That those are autosomal dominant disorders. So it means that in this person there was a new mutation. It's similar here with new mutation. So there are certain people, like this woman may not be affected of the disease, but she is transmitting the disease to her children because of gonadal mosaicism or new mutation. Is it clear? So this person here, you see that is not affected with the disease, but he is having a gonadal mosaicism. Means that what? It means that these gonads are affected, but all his body is unaffected. Is it clear? I also have carrier status disorder. So the keynote shows that black is affected male, this is affected female, this is possible carrier, this is no risk of carrier, and this is definite or obligate carrier. So those are the different cases that you have to know. The prior risk and all this can be used in conditional probability. Now there is also what is also called the Bayesian calculation method. Is it clear? And the Bayesian calculation method can be used in consanguinity and all that. Is it clear? I'm not going to speak about the Bayesian calculation method in this tutorial. So now the next thing you're going to speak about are the method of testing. Is it clear? When you want to test a carrier status, you can test the carrier status clinically and paraclinically. So those are different methods of testing of carrier status. Example, you can use a myotonia grip in order to detect myotonic dystrophy, the carrier status for myotonic dystrophy. So if you want to detect the carrier status of patient, you can use myotonic grip in order to know if the patient is a carrier or not. And this is how you do the myotonic grip. Is it clear? Now also you can use also the electro. So as paraclinical analysis, you can use electro neuromyogram, where you're going to have abnormal muscular contractions on that test. Is it clear? It can help you to know the carrier status. But lastly, after the clinical and paraclinical examination, you must have an analysis of the gene. When you do the analysis of the gene now, it is telling you now with confirmation that this is actually your carrier status, or this is actually your genetic status of the Mendelian disorder or any genetic disorder. Is it clear? So these are example of some common Mendelian amenable to carrier or pre-symptomatic testing by mutation analysis. So the carrier testing, we have hemoglobinopathies, cystic fibrosis, Duchenne muscular disorder, and all that. Pre-symptomatic testing, before you develop the symptoms, you can be tested with Hutchinson disease, myotonic dystrophy, like we said, the myotonia grip. Is it clear? So we have spinocerebellar ataxia, Charcot-Marie tooth disorder, and familial adenomatous polyposis. So all these were analysis. So those are analysis of genetics. So population screening can also be used as method for diagnosing the carrier status. Like you can screen the population with sickle cell carriers. That's a very good population screen in order to because sickle cell status is a very good recurrent thing in our context, a very recurrent disease in our context. So many carrier status are going to be analyzed by their hemoglobin electrophoresis. Is it clear? So I even counsel every person that is even hearing the tutorial in order for him to to be tested with electrophoresis, hemoglobin electrophoresis, in order to know the current status of sickle cell disease in population screening. Also in Europe and other northern European or northern countries, you also suffer, there is much of cystic fibrosis. So I also counsel all the people who are hearing the videos from that side to go and get the population screening for cystic fibrosis. Is it clear? So what are the conditions amenable to population screening? As I was talking about sickle cell disease in our context, that's Africa, Cameroon. And then I was talking about cystic fibrosis in European country. Tay-Sachs disease is mostly for Jewish country, that is Northern African countries and Middle East countries. Is it clear? Tay-Sachs disease and thalassemia disease are mostly for people in the Middle East, like India and all that. So these are mostly the ones that are amenable for population screening. And now for neonatal children, we have phenylketonuria because a very high inborn disease of metabolism. You have hypothyroidism that should be tested, and galactosemia that can cause even cataract. So all these are the diseases that I wanted to speak about today. So say thanks for your kind attention. Please don't forget to like and subscribe for our channel. Thanks very much.